As you go through life, your teeth can take a lot of damage and end up being broken or worn down. Now, I spoke with Dr. Stephen Marsh about ways you can help get those damaged teeth fixed up. Take a look. We are spending some time with Dr. Stephen Marsh in his offices here right off of Cedar and Brainerd Road off of the Highway 271. Doctor, let's talk today about chipped, broken, or worn down teeth.
And Joe, that can happen from almost any circumstance.
Right.
Sometimes as you get older, your teeth wear depending on your bite, that sort of thing.
Or we're grinding at night.
And that happens with a lot of people as they have more pressure or whatever.
Right.
We also have some people who are athletes and they will wear their teeth down. They can have an accident that can cause a problem. Sometimes teeth are just malformed as they come in, and sometimes dentistry that was done years ago wasn't able to replicate the normal shape of the tooth. All those things combine to give people a shape that they're not always pleased with.
Dr. Marsh, how many years have you been doing what you're doing?
45 years.
Okay, you have seen over those years so much change technology-wise, and people may think they're stuck with the smile they have or the chip they received back in high school decades ago. It doesn't have to be that way.
No, it doesn't, and because of different materials, as you suggested, we can use bonding, we can use veneers, porcelain crowns, all sorts of things. No more metal in our practice and in many others to give people a beautiful smile, one they're finally proud of.
Seeing is believing. Let's take a look at some of the before and after patients that you've helped.
Thanks. It means a lot to me.
Sure, let's do it.
So our first patient is James. I mentioned accident. So James actually was jumping over a fence. He fell, he broke his front teeth. It happens more with guys and girls, although women are catching up in that respect too.
It's so painful.
So initially when he came in, we wanted to cover the teeth. We wanted to make sure that the nerves weren't problematic for him. So we put some medication on. We bonded them at first, and then ultimately we gave him these 4 porcelain veneers. We also made a beautiful shape, and he ended up with a smile that for the first time in many years he was thrilled with. And
what fence? Never happened.
Right. It's cute that you said that. Our second patient, also an accident, Lauren, had fallen. Lauren was actually a teenager and had loosened her teeth, and ultimately Joe, those teeth became so loose, those teeth actually had to be taken out by an oral surgeon, not by me, and the area was grafted to maintain the bone. And then in Lauren's case, because she had lost so much bone, she wasn't an implant candidate, maybe more than your viewers want to know, when we actually gave her an 8-tooth zirconium bridge. It's porcelain, and we also were able to put pink porcelain to replace the gum and bone tissue that she lost.
Beautiful.
Thank you. And she said, "Oh my gosh, my teeth look better than before my accident." Not that we're encouraging accidents.
Of course not.
Okay, so our third patient's Jill. So Jill is more in my age, and over the years she had worn her teeth down. Somebody had done a crown that really didn't match, and she really wouldn't smile for people. And so she said, "I'd like a beautiful smile." So we reshaped the lowers. We did some veneers on the bottom, and we did veneers on the top to give her the smile that she said for the first time she's proud of. And last but not least, we have Sheila, and Sheila was an athlete. Ground her teeth, wore them down. She had a very gummy smile, so we raised the tissue. We were able to use a diode laser. And then we used some combination of veneers in the front and crowns in the back to rebuild her smile and gave her something that she's proud of and looks much more proportional. And she's smiling all the time now, Joe.
My goodness, no doubt about it. Now, if you're watching and you're thinking your tooth is chipped or worn down or there was an accident in your past, you can get that fixed right now by letting Dr. Marsh and his team give you the smile you deserve. Simply call 440-461-1003, or you can log on to the website clevelandsmiles.com, and that website lives up to its name.
Thanks so much,
Thank
Joe.
you, Steve.